I will be talking about climate change impacts on human health today, just a little bit more about my background to give you sort of a perspective on where I'm coming from. I'm an epidemiologist by training. My interests have pretty much been in infectious disease or environmental health epidemiology throughout my career. And I come from a practice setting. So she mentioned that I had worked for the Florida Department of Health. So a lot of my experience and my focus and my interests lie in public health practice rather than in academic research. So typically when we think about the impacts of climate change, we often think about the impacts on the environment or the ecological infrastructure, as in the photo shown here. So this is a flood event that occurred in the southeast region May 1st and 2nd of 2010 that shows flooding impacts related to extreme precipitation events that flooded the Mississippi River along the Tennessee, Kentucky, and Arkansas and Missouri borders. And so you can see on the left, that's a before picture, and on the right is an after picture. So we also might think about the economic impacts associated with climate change or the impacts that climate has on our infrastructure. You may not always consider that climate can have a more direct impact or a more personal impact on our lives in the terms of affecting our physical and our mental health. So many of the effects of climate change on human health are direct and kind of obvious. So when we're experiencing a heat wave, heat exhaustion, dehydration, those are pretty direct and obvious impacts, and injury and death after a natural disaster. But I hope you're going to learn about some not so obvious indirect pathways today. I'm going to give you a little bit of an overview of a variety of the climate impacts and how it affects human health. And then I'm also going to talk about what's being done at the local public health level to really understand these effects and also to respond to and adapt and intervene in terms of how we can improve public health response to these impacts. So every American is vulnerable to the health impacts of climate change. And these impacts vary across the U.S. We have seen wildfire seasons start earlier, last longer, especially in the West. We have seen heat waves become more frequent, more intense. Our average temperatures have increased between about 1.5 and 2 degrees Fahrenheit since we started collecting data back in the late 1800s. Droughts have increased and are lasting longer, particularly in the Southwest. Cold waves are becoming less frequent. However, severe winter storms are actually becoming more frequent as our climate changes. Flooding and extreme precipitation events are occurring with greater frequency and in many different parts of our country. And then also coastal impacts. We've seen the North Atlantic hurricanes increase in terms of intensity, frequency, and duration since the 1980s, and also sea level has risen on average about 8 inches along the mid-Atlantic and Gulf coasts in the last 50 years. So we're seeing a variety of impacts related to climate change. And climate can affect human health in one of two ways. It can change the frequency or the severity of health problems that we are already experiencing that can be affected by climate and weather. But it can also affect health in new, unprecedented, unanticipated ways as our climate changes, as our weather patterns change. So climate change impacts a wide range of health outcomes, and this slide, when it completes, is going to give you sort of an overview of the most salient climate change impacts, their effects on exposures, and the subsequent health outcomes that are associated with these changes in climate. So there are a wide range of environmental effects that we can experience with climate change. These include effects on ecosystems, storm and extreme weather events, air quality, oceans, and coastal environments. These changes can act individually or synergistically to impact our health. And just a few of the possible environmental risk factors and health outcomes are listed here. There are probably many others that we have not even considered yet. So in Tennessee, we would probably be most interested in impacts from thunderstorms, high winds, flooding, tornadoes, even extreme heat, drought, and winter storms. So I will try to put some things in the context of Tennessee, but understand I'm kind of new here and I'm just moved here from Florida, so a lot of my examples will be Florida specific. This is a conceptual diagram that shows some examples of possible exposure pathways in which climate drivers can affect human health. So in the center of the graph, we have selected climate drivers, exposure pathways, and health outcomes. And these pathways exist within the context of environmental, social, and behavioral factors that can influence these health outcomes either positively or negatively. The left shows the contextual factors related to the environment. So these are factors which are going to influence vulnerability on the large scale. And on the right, we have factors that are related to individual level vulnerability, including social determinants of health and personal health behaviors. On the next several slides, I'm going to introduce some of the key health-related impacts. And at the bottom of each slide is a reduced version of this figure that provides examples of the climate drivers, exposure pathways, and health outcomes specific to that particular climate impact, just to give you some different examples on each slide. So with climate change, we are seeing an increase in both the average temperatures and the extreme temperatures on both ends of the spectrum. Heat is a normal byproduct of our human metabolic processes, and we also absorb heat from the environment, mostly through radiation. We are able to regulate our body temperature and get rid of excess heat mainly through our circulatory system. So as external temperature and humidity in the environment increases, our ability to self-regulate decreases. We lose our ability to cool ourselves through evaporation, and we have to rely on behavioral modification and adaptation, like wearing cooler clothing, moving to a cooler environment, using air conditioning. When temperatures drop, on the other hand, and our body tries to regulate its temperature by constricting blood vessels in the skin, as temperatures are to conserve energy, and it kind of shunts our heat into the vital organs in our system, so shunts it to the core. But then as temperatures continue to drop, that process reverses and it tries to protect our extremities, so the heat is being pushed back out to prevent frostbite and things like that. Our body also responds by shivering, increasing our heart rate and our respiratory rate so that we can try to help ourselves generate heat. So on the left are diagnoses that are associated with heat, and on the right are diagnoses associated with cold. Some of these are pretty obvious, but temperature can also exacerbate pre-existing conditions, as well as being associated with increased hospital admissions and emergency department visits for a variety of chronic conditions, including cardiovascular disease, kidney, and respiratory diseases. The impact that climate change is going to have on air quality varies across the U.S. when we look at the outputs of different climate models. However, climate change has led to modified weather patterns, which we know can influence the levels and distribution of a variety of air pollutants such as ozone and particulate matter. Increasing carbon dioxide levels promotes plant growth, which in turn causes increases in air allergens, so an increase in allergic diseases. And then the projected changes in wildfire season and more frequent and severe wildfires is also going to have an impact on our air quality. Outdoor air quality affects indoor air quality as well, as these pollutants and air allergens get filtered into our buildings. Air quality has the greatest impacts on the human respiratory and circulatory systems. Health outcomes that have been linked with poor air quality include premature death, hospital admission and emergency department visits for acute respiratory symptoms, allergic illness, lung cancer, COPD, just a variety of different things, as well as lost school days and lost work days. Some examples of extreme events that are most important to human health include flooding from extreme precipitation events, hurricanes, coastal storms, tornadoes, wildfires, droughts, and winter storms. Health impacts from these events can be seen obviously during the event itself, but also before and after. So before we have, preparedness activities or evacuation activities, and then after we have post-event cleanup activities that can also lead to health impacts. Flooding and other storm-related events can be associated with a variety of health outcomes. We can see injury, drowning, death, carbon monoxide poisoning from power outages. Other concerns, though, relate to post-event disease spread that is associated with sheltering or just infrastructure disruptions. Reduction in water quality and quantity, dry air, and airborne particles during drought and periods of wildfire can cause respiratory illnesses. The water quality issues lead to food and waterborne disease and respiratory diseases, and all of these are associated with mental health impacts. And we'll talk more about mental health here shortly. So, climate change and vector-borne disease is a complicated topic. It's really difficult to predict how many of the vector-borne diseases that we might be interested in are going to respond to changing climate and weather patterns because of the complex transmission cycle for these diseases. But despite these complex relationships, we do expect to see some things. We know we're going to see changing distributions of vectors and related diseases. We are already starting to experience earlier tick season and also a geographically greater spread of tick activity. We're likely to see changing dynamics in many mosquito-borne diseases as well as the emergence of new diseases. So we've already seen that in a lot of our southern states with the introduction of dengue virus, chikungunya, and more recently Zika virus. So these emerging diseases are very much of a concern. So let's look at West Nile virus as an example. With climate change, we can expect warmer winters, longer frost-free seasons, and earlier spring. So this is going to influence the migration patterns and the survival of birds that are natural hosts for West Nile virus. Similarly, rising temperatures and changes in precipitation patterns are going to affect the distribution and prevalence of the Culex mosquito, which is the primary vector for West Nile virus. It's also going to change the habitat availability and the mosquito and the viral reproduction rates. Finally, changing weather patterns are going to influence human behavior, which is going to change how they come in contact with mosquitoes and how often they are exposed. So another example related to this uncertainty centers around precipitation. So we know that with precipitation, that creates habitats perfect for mosquito breeding and reproduction. However, when you have periods of extreme precipitation, that actually has a washing out effect. It washes away the vector for at least a short period of time. So, but we really need to understand better that sweet spot range of precipitation where it's better for the reproduction versus that threshold where it kind of reduces the impacts for a little while. There are just so many water-related impacts on human health that it's really hard to pick just a few to provide as examples. Some of the main climate drivers associated with these impacts are temperature, precipitation patterns, flooding, sea level rise, and sea surface temperatures. That's the other one. These climate drivers affect coastal salinity, it affects runoff, nutrient concentrations, and contaminants in our environmental and our ecosystems. For example, precipitation and temperature changes affect fresh and marine water quantity and quality through runoff from urban areas, rural areas, and agricultural processes. So this all leads to a change in the distribution or an increased frequency of exposure to pathogens such as algae, cyanobacteria, enteric bacteria and viruses, and protozoan parasites. The main exposure pathways that we're going to be influenced by with climate change are exposure to drinking water, recreational water, and then also shellfish and fish consumption. So these exposure pathways lead to an increase in a variety of health outcomes, including gastroenteritis, neurologic illness, asthma exacerbations and respiratory arrest, liver and kidney disease, and even septicemia. So the food system involves a complex interaction between environmental systems, physical, and biological as we move from the farm to the table, basically. So climate change is going to affect the quality and distribution of food, as well as the food safety and nutrition. The most likely climate impacts will be rising temperatures, changes in humidity, and weather extremes. Such climate impacts are likely to increase our exposure to certain pathogens that cause foodborne illness. We can also see an increase in chemical contaminants in our food chain. So some examples of this are increased sea surface temperature, increasing the concentration of mercury in our fish. We talked about the change in vector patterns, so that's going to lead to an increase in pesticide use, which will be running off into our water supply. We also are likely to see lower nutritional value of food because the increase in carbon dioxide levels actually reduces the nutrient content, especially like the protein content in our plants and minerals. And then finally, extreme events may cause disruptions in the food distribution system. So I've kind of touched on mental health and well-being, but climate change creates interrelated mental, physical, and community health effects that we have to understand. We've already talked about many of the physical effects. I just wanted to talk briefly about the mental and community health effects. So obviously, exposure to natural disasters can lead to very serious mental health consequences, everything ranging from post-traumatic stress disorder to just general stress, anxiety, and depression. Most of these mental health effects are expected to get better as the recovery from the event progresses. However, some do develop into chronic conditions. Also, specific groups of people are going to be more prone to the mental health consequences from these climate events. Groups like the elderly, children, women, especially pregnant, and women in the postpartum period. Also, people with pre-existing mental illnesses, the economically disadvantaged, the homeless, and even the first responders. They are the ones that are more susceptible to these impacts. Interestingly, extreme heat increases the risk for people with pre-existing mental illness and certain behavioral disorders, and this can happen through a number of mechanisms. So it could be something about the nature of the disorder itself that predisposes these people to more severe heat-related illness effects. For example, with schizophrenia, that's associated with dysregulation of our thermoregulatory system. Also, depending on the condition, an individual may just not have the same ability to cope with or adapt to these climate effects. And then finally, there is actually some prescription medications like antipsychotic medications that can actually also hinder our ability to thermoregulate. There are also community level impacts that affect mental health and community health well-being, including increased interpersonal aggression, violence and crime, social instability, and then decreased community cohesion. I've already touched on this some, but wanted to return to the question of what makes some people more affected by climate change than others. Just because an individual is exposed to one of the environmental risk factors we've talked about, it doesn't necessarily mean that they will experience a negative health outcome. So there are various internal and external factors that affect someone's risk of disease, and the susceptible or vulnerable population may be different for each climate effect and health outcome. So we have to understand that as well. Who is susceptible, who is vulnerable to these impacts? Susceptibility refers to the intrinsic factors of the individual that increase their risk for negative health outcomes. Examples of this includes genetics, developmental or life stage, medical history and presence of comorbidities. And then vulnerability refers to lifestyle, behavioral, or environmental factors that may make someone more vulnerable to these effects. So Health-related behaviors like drug and alcohol use, smoking, poor nutrition, limited limited physical activity. Then socioeconomic status and poverty affects someone's ability to receive and access certain medical services or basic needs. And then the built environment deals with things like someone's access to appropriate shelter, green space, things like that. So what can we do to understand and respond to these threats to human health? And like I said before, I'm going to talk about this from the public health practice side. So we have vulnerability and health assessments and disease burden projections. All of the things I'm going to talk about are used by public health officials and epidemiologists to better understand and adapt to these threats that climate change is posing on our health. The Centers for Disease Control and Prevention have developed a 5-step framework called the Building Resilience Against Climate Effects, or BRACE framework, and I'm going to talk about a couple of these steps in that framework that we've applied to a number of jurisdictions around the country to better understand these effects. So I'm going to also just provide a few examples. So one of the first steps is really understanding your population and understanding where their vulnerabilities lie. Social vulnerability refers to the human factors within a community that negatively affect its ability to manage these disasters or other like environmental hazards that are harmful to our health. And understanding where these vulnerabilities exist help communities plan for and respond, and hopefully to mitigate the impacts that the area is going to experience. And there are a number of ways to understand community level vulnerability using these vulnerability assessments. These assessments are typically, for example, a spatial analysis of future climate hazards and relating that to our current level of social vulnerability and even medical vulnerability. So social vulnerability, you can either do this through indices or looking at individual factors or indicators. So just an example of some of the indices. So there's the Social Vulnerability Index that some of you guys may have heard of. It reflects characteristics of social groups that influence their ability to prepare for and respond to environmental threats. It includes components of sociodemographic variables such as, race, ethnicity, gender, age distribution, whether you live in a rural or urban location, are you a renter or a homeowner, population growth of an area. All those factors are kind of contained in one index to understand the vulnerability of an area. The Medical Vulnerability Index is not a very widely used measure. It's rather new, actually, that is used to reflect indicators of health need with inherent medical vulnerability outside of that social context. So it really takes into account physical health needs, psychological health needs, healthcare access, as well as the health system capacity and infrastructure of an area. And then what we really want to do is look at the intersectionality of our hazard vulnerability with our social and medical vulnerability. So understanding that helps us to better understand how we can adapt to these impacts. So if it's an area that's more socially vulnerable, then we may want to implement interventions that really deal with the social demographics of an area. If it's the hazard or the climate impact that's the most important factor, that's what we would focus on. Or if it's the combination of the two, it's just knowing that information is going to change our focus on how we adapt and mitigate our responses. So this is the Social Vulnerability Index for the United States. It compares and ranks every community at the census tract level across the US. And this is using 2014 data. And so you can see how social vulnerability varies across the country, with the dark blue areas being the most vulnerable. Now I'm going to zoom in to Tennessee and specifically to Knox County. And we can start to see where patterns emerge, where areas in Tennessee are most vulnerable socially anyway to these environmental hazards, and even within Knox County. So now I'm going to provide an example of that intersectionality. So on the left here, we see the Social Vulnerability Index mapped for Florida at the census tract level, and this shows how that vulnerability is distributed around the state, with the most vulnerable tracts being in red and the least in blue. And on the right, that shows the statewide level risk, again at the census tract level, for Category 5 storm surge. So one of our impacts of interest in Florida is obviously the impacts of hurricanes. So this is looking at storm surge. And the dark purple areas are the areas most at risk for storm surge. Now this map shows that intersectionality where we can start to see where social vulnerability and storm surge risk are the greatest. And that's, you can see areas down, my mouse is not going to work, in Miami-Dade County where they are the most at risk for both of those factors. And then around the state, you can kind of start to see patterns emerging where the social aspect is most important and where the hazard itself is most important. So you can use this information to implement interventions and adaptation projects. The next step in the process after we start to understand our vulnerable areas is to understand current or historical impacts between climate and human health. So like for example, say we want to understand how the relationship between extreme heat and hospitalizations or flooding and gastrointestinal illness. We can use a variety of epidemiologic study designs to do this. However, we are limited in our ability to actually conduct studies about this due to a variety of factors. So first, and most importantly, there is no specific data source available that was created to address this issue. So we rely on using available data sources that were created for other reasons. So things like reportable disease registries, hospital records, vital statistics registries. That's on the health side. And on the climate side, we rely on station level, weather station level data, or as you can see here, an example of gridded level weather or climate data. We use these data sources then to develop appropriate indicators for our our research question of interest, whether it be the number of events of the particular climate impact or the number of health-related events and the rate of those events. And then we use a variety of epidemiological study designs like time series, case crossover, or case series studies to start to tease out the impacts or the associations between our exposure and our disease. There are also a number of other methodological challenges that we're experiencing in trying to understand these impacts. So how do you define an event? There is obviously like a meteorological or a climatological definition of an event, but how does that then relate to the health event? How do we define our time period of interest? Then there are varied impacts. Some of our health impacts are direct and some are indirect. So when you have these different causal pathways, it makes it even more complicated. And then finally, the spatial and temporal resolution of the data. So the health data is going to be collected maybe on a daily count or by zip code or by county, whereas the weather and climate data is going to be station specific or grid specific. And how do you make those mesh? So those are some problems that we are trying to overcome. So here's an example of a study that the World Health Organization conducted to understand the global impact of climate on health based on 4 specific health outcomes. So they were looking at cardiovascular disease that's related to temperature, malnutrition, diarrheal illness, and malaria. So this study estimated that worldwide we had experienced approximately 150,000 deaths due to climate change in 2000. And that was also associated with 5.5 million disability-adjusted life years. So this figure shows the estimated deaths per million people attributed to climate change by WHO subregion. And you can definitely see the difference between the developed world and the developing world. Here's an example of understanding these associations at the state level. This figure shows the combined effects of wind and storm surge from tropical storms and hurricanes on hospital admissions and emergency department visits for all-cause unintentional injury and carbon monoxide poisoning. So for all-cause injury over here on the left, you can see that there are small increases in rates associated with a hurricane event. And in fact, for ED visits for injury, there was only a 3% increase compared to non-hurricane periods. Whereas for carbon monoxide poisoning, there was a much greater increase. So during a hurricane event or tropical storm event, we saw an increase in 3.4 times the rate after a hurricane compared to non-hurricane. And then if we looked at just hurricane events, so the more severe storms, we saw an increase of 11.7 times. So much bigger. So after we sort of tease out the relationship that we've experienced, currently or in the recent past between climate and health, then we can start to plan for what we're going to experience with climate change, plan for the public health impacts of those changes. So to effectively project the burden of these health outcomes, we need a variety of inputs. Not only what we just developed with our historical or current associations, but we also need things like the actual estimated change in climate. We need to understand the baseline rate of disease, and we also need population projections. So we need to know how our population is going to change. So this is an example, a heat example, where we did disease burden projections, and we were projecting the additional heat-related illness cases per year to the emergency department out to 2040 and 2070. So we used the change in our climate was measured by the number of days that were above a given temperature threshold. Then our baseline rate of disease was the mean daily count of emergency department visits for that particular diagnosis. Then we used our rate ratios to develop an attributable fraction, which is basically saying how much of the disease is due to the exposure that we're looking at. So we're taking out the background risk for heat-related illness, and we're just looking at, my students should know what this means. So we're just looking at what's due to that particular exposure. And then finally, we needed the expected population in that same time period. So here are the results from that disease burden projection. This is broken down by National Weather Service region in Florida. And again, we're projecting out the additional heat-related illness cases, so above what we are already experiencing per year in Florida for the period 2040 to 2070. And you can see there's a lot of variation across the different regions. So up in the panhandle of Florida, they might not need to plan for these additional cases in their emergency departments as much as somewhere, down in Central and South Florida. So why are these disease burden projections important? They can help us strengthen our public health preparedness and response plans around these climate-sensitive health outcomes. So for instance, one way that the heat-related illness projections could be used would be in developing our county-specific heat adaptation or response plans. So let's say, especially in Florida, we have an aging population, and we are very concerned with rising rates of, say, kidney disease, which is associated with extreme heat, or it can be exacerbated by extreme heat. So if we were to understand the magnitude in which heat-related illness was expected to occur in our county, we could then develop strategies to focus on our at-risk population in order to help them adapt to this changing temperature projections. And then finally, one of the last steps is to actually implement evidence-based interventions and adaptation projects. We have an abundance of evidence available linking our climate-sensitive exposures to our health outcomes of interest. However, where we are lacking right now in public health practice is evidence related to the effectiveness of interventions in these settings. This makes it really tough to know where to begin in designing and implementing public health interventions to address these issues. So on the right, you can see an evidence rating that was adapted from the county health rankings that can be used to, can be applied to literature reviews on these issues to see where we have enough evidence to scientifically support these interventions and where we need to do more work and where we need to make changes. So here's an example of heat-related illness interventions. So there's a variety of interventions here. These include interventions at both the primary and secondary level of prevention. So that's really focusing on preventing exposure to begin with, and then if exposure does occur, getting people treated early so to prevent major health issues. And from an ecological model perspective, these interventions range from the individual level to the systems level and to the environmental level. So as you can see, based on extensive literature review, very few of the interventions are actually scientifically supported. Most of them lack sufficient evidence for us to know that they will actually work if they're implemented. So we have to decide as public health practitioners where we are going to focus our efforts, where we are going to put our resources, our time, and our money to adapt, help our populations to adapt to these impacts. So our understanding of climate change is evolving, as is our understanding of the impacts of this on human health. We need to continue to work towards improving this understanding of these complex relationships in order to be able to improve our health in the future, help ourselves adapt to and respond to these. This is an iterative and interconnected process that helps us to prioritize climate hazards and related health outcomes and helps us target our adaptation and public health interventions. So it's an ongoing process. A lot of these activities are being implemented by state and county health departments. The CDC is heavily involved. And so we are really working towards this better understanding, towards improving our evidence base in these areas. Oh, hi, yes.
Could you back up a couple slides where the
Tell me when to start.
Florida numbers, yeah, that one there. That's the average increase you're expecting?
Yes.
What would the normal be for? Do you have that data?
Not with me right now, but that is...
Is that like doubling or adding 10%?
It varies by region.
It does?
Yes, it does. So I apologize, I don't have that baseline data off the top of my head, but it does vary by region. And this average is based on using the projected temperature increases from 10 different climate models. So that's where we get that range. Yes.
If I'm a planner or metropolitan emergency situation planner, how can I use your data to identify things that I can do while there's no emergency and things that I have to do when there is an emergency?
That's a very good question. So I think it probably depends on the nature of the impact, but so all the different jurisdictions that are involved in these activities are doing things a little different. In Florida, what we tried to do was to develop a suite of adaptations and interventions that would be available for local jurisdictions, again, evidence-based, rating that evidence, but that provides them with options that they can implement, now versus when they have to, like what they have to implement after an event. So I guess we are still in the process of developing that guidance and that understanding, but there are a variety of different things that could be implemented in both. But using, the vulnerability data can help you understand where you can intervene on a social level versus the hazard level. Yes.
Who's doing that?
Well,
What cities or metropolitan areas?
so that varies. So the CDC is actually funding, I believe it's 16 states and 2 cities all across the country to implement these activities, but then there are also other communities that are doing it without that funding or through other funding sources. So some examples of the cities. So in the Southeast, the only 2 states that are funded are Florida and North Carolina. There's a variety of Northeast states several Midwest states, and then California, Oregon, and Arizona out west. And then the 2 cities are San Francisco and New York City.
And not Texas.
No. Yes.
What's your level of confidence of the projections there, particularly on the outer end?
Well, you see the range. We're still working, so you have to understand that these disease burden projections were done by public health practitioners. That means we had to learn what the climate models mean, what that output means. We had to decide which climate models were most appropriate for our jurisdictions. And a lot of the grantees that were doing this work, either there was 2 schools of thought. You either had the experts do it or you tried to do it in-house. And in Florida, we did it in-house. So I think that this is a very basic level of projection. It could use some refinement. So I think the confidence isn't super high right now. Yes.
You've scared us all with all these different dangers, properly
Sorry?
so. What for you, as an expert in this field, is the gravest danger, the greatest hazard, the thing we might not have expected?
That's a really tough one. I think that probably, for many reasons, it's probably mental health, because that's the hardest for us to measure. It's the hardest for us to respond to, especially after disasters when our infrastructure is broken down, and it can have so many effects on our life, from our physical health to our interpersonal relationships. So that is my personal thoughts, but you could ask another person in this field and they might say something different. Oh.
2 quick questions.
Yes.
I had not heard about CO2 being an issue after a disaster, so maybe explain that in case I can avoid CO2 after a disaster.
Well, I think it's more just the levels that we are currently experiencing, but then like after wildfires, when there's even more pollutants in the air. So I think the disasters are just exacerbating our exposure.
Okay, it's not a specific thing per se. I was thinking of ruptured pipelines or something. I don't know what I was thinking.
Just don't breathe after a disaster.
Just don't breathe.
Just don't breathe.
My other question was, what things do you see like sort of reaching a tipping point for Tennessee? Are we going to start getting West Nile virus like crazy? Are we going to start getting Lyme disease? What?
That's a tough one, especially the vector questions, for the reasons I explained. I mean, it's really hard to predict how vector-borne diseases are going to respond to climate change. I do think that, like with Lyme disease, it's a little bit maybe easier to project because that is going to be expanding geographically. We can see a lot of evidence of that already. West Nile virus is a little bit harder because we have that extra factor of it's not just the vector and the human, it's also the bird population that can affect the transmission cycle. So, like I said, I'm new to Tennessee. I'm still learning, what's the important exposures here. I'm still learning about the climate impacts here and things like that. Oh, yes.
Yeah, the level of uncertainties you're dealing with is absolutely amazing, and it's hard to plan. And then there's the people that talk about solar cycles and say that we're way overdue for a little ice age.
Mm-hmm.
Not merely warming, but really ice age.
Yes, and the level of uncertainty is exacerbated because not only is it related to the climate impacts, the future climate impacts, but it's also related to just even understanding what's going on right now with health, because for all of the health conditions I've talked about, there are so many things that affect those health outcomes. So it's not just climate. So understanding the causal pathway and the multiple risks associated increases the uncertainty. Yes. So it's a very challenging methodological question. Yes.
I aggravate my daughter who lives in the Orlando area. That,
That's hot.
She lives near Central Florida, and I say, you may be a beach sometime. That'd be a positive.
Yes.
Really supposed to be working more for a while.
There
Yes.
So you gave an example on Florida and how events like tropical storms and hurricanes are affected by climate change and how those in turn affect a state like Florida. But for a state like Tennessee, which is a little more inland, let's see, hurricanes, aren't as big of a concern. So what do you see, in your opinion, as some of the greatest effects in Tennessee, or that climate change has upon a state like Tennessee or like Kansas or something like that?
So I think that all states, and particularly Tennessee, need to be concerned with the increasing temperatures. So increased frequency and duration of heat waves, but also just the increase in average temperatures. And flooding events, precipitation projections are varied in what we're expecting, but the extremes are going to become more frequent. So extreme precipitation events or extreme drought, so lack of precipitation, as well as tornadoes and winter storms. I mean, even though our temperatures are rising, we are going to be experiencing a greater frequency of winter storms.
Early on, you had spoken about the negative impacts of extreme heat and extreme cold, but there are portions of the world where people live in extreme heat or extreme cold, usually not both. What impacts does that have on them, or have they physiologically adapted to living in hot weather or super cold weather?
That's a very, very good point that
And
you
do we
made.
adapt eventually?
Yes. So that's another reason why we are a little bit uncertain with these heat-related projections, because we don't have a great way of introducing human adaptation and acclimatization into these disease burden projections. But yes, there is an element of human adaptability that's going to happen over time that's just really hard to quantify, I guess. So that will help. But then, for example, the populations who have acclimatized to extreme cold weather, when their temperatures start increasing, they're going to have to reverse their their adaptation processes and start to adapt again to changing temperatures in a different way. But yes, that is a very important aspect.
Florida and Louisiana for 25 years. I don't know how Florida is, but Louisiana's had a good bit of subsidence, and so the earth is actually dropping a little bit. The elevation is going down, so the water is coming up. But in that case, it's not directly related to temperature changes. It's related to what's happening with the geography.
We have some of that going on in Florida as well. Yes. Did you have a question?
My recollection is that the storm that hit the Gulf Coast of Florida Panhandle was the first one in a number of years that was significantly destructive.
Okay.
Is it hard to get people to plan for events that are infrequent, and if Florida for 2 or 3 years, say, which is very possible, escapes any major storm systems, you have a difficult time saying, we've got a problem here, when the evidence that I see right in front of me is that we don't have a problem right now.
Yes, so we did experience that actually with hurricane preparedness. I mean, in general, Florida does fairly well. They've experienced enough that they plan for. All of our counties are required to have a plan in place for these types of impacts. But we did experience this hurricane drought, basically. So our last big hurricane year was 2005, and we didn't experience one until more recently, in the last, I guess, 2 years? Year. So there was that drought period where interest kind of lagged. Yes, and so talking about the health effects didn't necessarily interest that many people until, again, after the impact.
So I'll give Dr. Kintziger
Thank you.